Most rural clinics we participated in, it was vital for those communities. Most of the communities in Ensenada and the surrounding area are built up and spread out. For many, this means the nearest clinic could be at least 30 minutes away from them or further. Another factor that we learned about was that transportation is hard to come by, and there's possibly a lack of transportation to the hospitals and clinics. This also goes for ambulance rides. If you need to go by ambulance, most people would expect to pay out of pocket for that cost, and that's for most of Mexico. And then finally, the cost of healthcare, which in Ensenada, many cannot afford the cost of healthcare, often due to the poverty levels, and costs are a problem in Ensenada, but also all across of Mexico. We interviewed 2 translators on our clinic days, which you'll see further in the video, which kind of helps explain more in depth about the healthcare system and kind of what we learned while we were there. Another thing we learned about was a few of the healthcare facilities in Ensenada. The first one on top there is a clinic and daycare for low-income families, particularly used for single mothers with children, and they provide free care to the mother and also child care during the day for the mother. The second one there is a new public hospital being built in Ensenada. It'll be the second public hospital in all of Ensenada and the biggest, but it will primarily be used for those who have working jobs in the community. And then the last one there is a private hospital near the cruise port, which we toured on our last day in Ensenada. And this hospital is small in size and the number of rooms, but it includes imaging, OR, inpatient pharmacy, ICU, regular hospital rooms. They included rooms that monitor those who are in more need of continuous monitoring, and then a smaller room for urgent care, and also a check-in counter in 2 different areas of the hospital.
Okay, for disease incidence and prevalence, there were 20 new cases of TB in 2022. There were 13.2 HIV new diagnoses in 2022. There were 4 reported cases of human rabies. The overweight and obesity was 73.4%, and the prevalence of tobacco use among ages 15 and older was 11.9%. The top causes of death per 100,000 people in 2021 include COVID-19, which was 286.5, ischemic heart disease, which was 112.6, diabetes, which was 71.4, kidney disease, which was 28.5, interpersonal violence, which was 28.4, stroke, which was 23.4, and cirrhosis of the liver, which was 21.
Education for various healthcare jobs, like physicians, takes 4 to 5 years, with 1 year of undergraduate intern and another in social services after the initial undergrad. An exam called ENARM is required for their licensure. For bachelors of nursing, it's 4 years, and they do not take a national exam like the United States and can practice immediately after graduation. For a dentist, it's 3 to 5 years plus 1 year of community service with no exam post-graduation. For a pharmacist, it's 4 to 5 years with a thesis required, which is usually an extra year. Physical therapist takes 4 to 5 years with a bachelor's minimum and must be granted a licensure after clinicals and degree completion. Nutritionalist in psychology takes around 3 to 4 years with a bachelor's minimum. Any master's programs takes an extra 2 years, and a PhD program takes an extra 3 years in Mexico.
A lot of family here that don't go to the hospital due to the fact that it's too much to pay, or it's a long drive, and some of the families don't have a transport system or anything like that. So, do you have medical issues but deny on going due to the fact of not being able to pay the full amount and start getting more ill and more ill? Yeah, we only have one main hospital in Ensenada, and clinics from here, we only have one clinic, which is a pharmacy. It's like a 30-minute drive.
Okay.
Usually when it's about their children, they are willing to go and do the process and waiting hours and long hours. But when it's up with the parents, they're just like gonna sit around and just let it die alone.
Yeah.
But yeah, most of them are just like, okay, look, it's just a cough or it's just a fever. I'm just gonna let it go off.
While at Agua Viva, we had a translator named Rachel, and she stayed with us in the dorms, and we asked her a few questions about Mexico and their culture. So we first asked her, what are some common home remedies and or traditional healing methods of Mexico that you know of? And right away she was like, Coke. Yeah, if you have a stomach ache, drink Coke. A lot of grandmas and moms do this with their kids. Also, there's a strong belief in chicken soup. It can help a lot when you are sick, or if we have a cold, we will use vapor rub. We will lather it all over our chest and back and right underneath our nose. And right away I told Rachel, I was like, this is kind of very similar to American and like America and how we do traditional healing in a way. Instead of Coke, we use Sprite and ginger ale commonly for upset stomachs. We do have chicken noodle soup when we're sick, and we do use vapor rub when we have that congestion. So I told her there's very similar healing methods that families use in America as well. Next, we asked her how important is family involvement during medical decisions. And she said it is really important, especially if it is an older patient like a grandparent and they have kids who want to give input in their recommendations. Family is really important in Mexico. And we definitely saw that in our week there. We saw how rooted in culture family is in Mexican culture. And just at the clinics, it was very obvious. You know, you had brothers bringing younger brothers in, you had parents bringing their whole family in. It was really shown the week we were in Mexico. We then asked Rachel, are there any cultural taboos or stigmas related to certain illnesses? And she said the one that she thinks of is AIDS because most of Mexico is Catholic. So if someone gets AIDS, they're automatically assuming, oh, they slept with another man. As in, like, another man slept with another man. And this leads to kids at school being shunned by others because families and kids are either not informed with how AIDS is transmitted or they are scared of it. And, you know, we saw that too, where a lot of the people in Mexico and Ensenada just lack medical knowledge, health knowledge, and they aren't able to be seen by, you know, a primary physician and have checkups regularly because they don't have those resources and they cost a lot of money and it's not very accessible for them. So, yeah, she talked about AIDS and how that's the one that is commonly seen and prevalent in Mexico. The last one we asked her is how do people in Mexico view preventative care such as vaccinations and checkups? And Rachel said for kids, since she lived through this, kids get these tiny little booklets that have all their vaccines. They will ask parents to sign a consent form at school if they want all their kids to get their vaccines at school. Instead of taking them to an actual hospital, this way they don't have to pay for it because it's funded by a program such as Universal Vaccination Program. And Rachel was saying, you know, we are very pro vaccine here because it's a way to prevent illnesses, meaning we can save money since we don't have many resources to get these vaccines and pay for these vaccines.
For alternative medicine in Mexico, there are many traditional and alternative medicines which primarily stem from the indigenous practices. The Promoteros de Daldu, which has basic healthcare training, serve as a link between communities, health clinics, and mental health centers. The Herbolaria and Yerbero, which offer herbal medicines to treat diseases. The Partera, which are traditional midwives. And then we have the Curandero or the Cuandera, which are important in restoring health balance and order. They use therapies and herbs, medicinal plants, prayers, chants, and other rituals to restore balance in patients. Common herbs medicines used are nopal, peppermint, chaparral, dandelion, mullein, chamomile, nettle, passion flower, linden flower, and aloe.
Okay, next we're just going to talk about the healthcare education and health literacy of Ensenada. So just a quick overview of the healthcare system. There's both public and private healthcare services that are available. There's the IMSS, which is Mexican Social Security Institute, that provides care for employed individuals. And then there's also the ISSTE, which covers government workers, as well as Seguro Popular offers coverage for the uninsured. Then for health literacy challenges, there's limited access to health information, especially in rural areas. There's language barriers for ingenuous populations, and there's low awareness of preventative healthcare measures. Next, for education and outreach efforts, government health campaigns on vaccinations, diabetes, and maternal health. There's NGOs and universities that provide community health education, and there's an increasing use of digital health resources for patient education. For common public health concerns, there's a very high prevalence of diabetes, hypertension, and obesity. There's very limited access to clean water, and there's a lot of sanitation issues in the communities, and also rising awareness of mental health, but there are limited resources for that. Then, lastly, opportunities for improvement, expanding mobile health clinics for the rural areas, strengthening schools based on these health education programs, and then increasing training for healthcare providers and patient communication and cultural competency.
Mexico does not have any reimbursement systems for the public health care, and reimbursement is only for private insurance, and each company decides prices according to its policy. The public healthcare is funded by general taxes. Private is out of pocket, or you pay for private insurance, and this is very expensive for the general person. Providers don't make as much doing public healthcare compared to private healthcare, so sometimes they are limited.
Lastly, we're just going to talk about a few of the differences between Mexico and the US's health beliefs and the healthcare systems. So to begin, the cultural approach to healthcare in Mexico, they really emphasize holistic and empathetic communication, integrating traditional medicine practices like curanderismo alongside modern treatments. Whereas in the US, they focus on specialization with the direct and clinical communication style, prioritizing technology advancements and research driven treatments. And then for the role of the family and the individual, in Mexico, the concept of familismo places the family at the center of healthcare decisions, with families deeply involved in medical scenarios. And then in the US, we value patient autonomy and personal choice, often adopting a more individualistic approach to healthcare. Then for the healthcare system structure in Mexico, they feature a mix of public health insurance programs, employer provided insurances, and private out of pocket care. The system is divided into three main sectors, which is private, social security, and public. And then in the US, we lack a universal healthcare system, relying heavily on private insurances, employer sponsored plans, and government programs like Medicare and Medicaid. For healthcare spending, Mexico spends approximately 6.1% of its GDP on healthcare, with about 45% of healthcare expenses paid out of pocket by individuals. And then in the US, we allocate a higher percentage of its GDP to healthcare, with significant spending on both public and private healthcare services. And then lastly, just access to care. So as of 2020, public health care is provided to all Mexican citizens, with services fully subsidized by the federal government. And then in the US, access to health care is often linked to employment and insurance coverage, leading to disparities in care availability and affordability. And then lastly, we just have all of our sources.